So in terms of conservative option, there's gonna be a whole list of things. Some patients do part of these, some patients do none of these, some patients do all of these. I always start my patients on a formal course of physical therapy. That's going to the gym with a trainer, going to the gym with this trained physical therapist expert. They help strengthen the core muscles, abs, your quadriceps, your hamstrings. They show you different activities you can be doing at home, different stretching modalities, really working on your hamstrings. I know I keep circling back to that. That's just a big part of spine pathologies that us as spine surgeons have gotten a lot better understanding of, and that's how the hamstrings are involved in all of this. I'm also okay with involving other specialists, such as a chiropractic provider. The chiropractic providers, I don't want them popping your back or doing all these crazy things that you see on TikTok videos. That essentially has no role in medicine, but deep pressure on the muscles, stretching, maybe very mild lumbar spine manipulation and stretching is okay. I'm okay with acupuncture, I'm okay with cupping, I'm okay with aquatic therapy, why not, right? TENS units, electrodes on the back bracing from time to time, ice and heat therapy, of course. I'm not going to go into certain specifics of medications in terms of dosages, but there's definitely a role for certain medications to help the back pain and shooting down pain. Some of these medications could be a Medrol steroid dose pack that's been shown to be extremely helpful in mitigating the acute pain a patient might be having. Anti-inflammatories such as NSAIDs, non-steroidal anti-inflammatory drugs, are very, very helpful in helping decrease the inflammation either around the joints or around the nerves or around the disc space. Gabapentin, Lyrica, pregabalin, those are all somewhat kind of the same medication in a way that helps with some of the neuromodulation of those nerves. Muscle relaxers from time to time. Again, you might be thinking at home, goodness, I'm taking all those medications and I'm still doing terrible. Well, that's when surgery might have a role, and we'll get to that in a minute. And the other thing I haven't talked about a lot is, as the spine surgeon, I love being the quarterback of my patient's care, and I very frequently will direct them to one of my pain management colleagues. Now, what do those pain management doctors do? I'm not talking about spinal cord stimulators or pain pumps or any of that stuff. What I'm specifically talking about are different injections. Steroid injections, lidocaine injections, marcaine injections, different injections to help calm down the irritation, calm down the inflammation. But there's definitely a role for steroid injections in treating both back pain as well as numbness and tingling, something called radiculopathy, pinched nerves. Many high-impact studies in peer-reviewed journals support this. There's no debate that those are effective.